Good day and welcome to Massage Matters. I'm your host, Chris O'Connor. Massage Matters is designed to give you a hands-on look at the various manual therapies that are available to help you heal your mind, body, and spirit. Massage Matters strives to raise the awareness of these therapies within our community. My hope is that by explaining and demonstrating them, those of you watching will put them to use, encouraging you to become more involved with your health care. Each week features a specific technique, and in some cases we bring an expert guest on board to teach us what we need to know. Some of these therapies you may be familiar with, but I'm sure there are some that will be completely new to you. After we've demonstrated these techniques, you'll be better equipped to decide which treatment is best for you. Today's show will be all about CranioSacral Thearpy. We have in the studio today my special guest, Lori Kanar, and she's going to go over what CranioSacral Thearpy is, some of the reasons people choose to get CranioSacral Thearpy, and some of the conditions she treats. Later on, we'll be at the table with Lori and a volunteer to show you what a typical craniosacral treatment might look like. I'm ready, and I hope you are too, so let's get started. Welcome to the show, Lori.
Thank you.
Pleasure to have you here today.
Great to be here.
So, just give us a little bit of background about yourself from sort of a professional level.
I decided to become a massage therapist pretty much right out of high school. I had had some back issues through a part-time job I had, and thought it would be a great way to be able to help people, and is something I could always take with me. So I decided that that was the route I wanted to go instead of, university and all the other fun stuff. So
Right on. So about how many years have you been a professional now?
I've been a professional for just over 16 years now.
16 years, nice.
Yeah, hanging in there pretty good.
Yeah, that's good. Considering our profession is like 3 years, sometimes they say is the burnout rate.
Yeah,
so you're doing
I
really
figured
well.
I'm, antique now.
That's good. Way ahead of the curve. That's good. What got you interested in craniosacral therapy?
A few different things, actually. One of them was I had clients that had previously had craniosacral therapy and as I'm doing massage on them, they would react in a more craniosacral way, per se, on the table, and I wasn't sure what was going on. And they were telling me, oh, this is what craniosacral has happened, and just hang out where you're sitting, and when I'm done, I'll let you know, and then we can continue on with the massage. And I was very intrigued by this, and
Right.
bodies can do this.
Okay.
This is fantastic. And so I decided from there on I should probably take the course, and I figure if this is helping the clients, I can better facilitate, hopefully, helping other clients out as well.
All right. So you decided to take craniosacral therapy. What's sort of the background of craniosacral therapy? Sort of a little bit of the philosophy.
A little bit of the philosophy and background is it evolved actually from traditional osteopathy, and Dr. John Upledger has taken traditional osteopathy and kind of put his, I want to say, spin on it, or has done more research and found things that he finds are relevant through the craniosacral system that he can teach to therapists in smaller courses and allowed to bring them through without having to do the full-on scope of osteopathy.
Doing osteopathic treatment. So who typically trains in craniosacral stuff? I mean, obviously massage therapists, but are there other professions that are doing
Certainly, I've taken courses with massage therapists, with chiropractors, with athletic therapists, with physiotherapists, even some, I believe we've even had psychologists in classes. So it's been a fantastic variety of people.
Nice. So during the treatment, what are your clients? What are the people on the table typically feeling? Is it something is it a gentle technique?
It's a very, very gentle technique typically, no more than 5 grams of pressure, and it's very light touch. It can be integrated in with massage, in my case, as well as it can be done as a standalone treatment, which is really nice. And they generally feel very relaxed, very comfortable on the table. They may feel things changing very gently, slowly moving and adjusting, per se,
Right.
and either where I'm treating them or somewhere else in their body, because cranial basically focuses on the body's fascial system, and by doing that, it's one big piece through the whole body. So even if I'm treating down at a knee or at a hip, they may feel a shoulder or a low back or something also adjusting, because it is one big system through the body.
Right. So unlike a chiropractic adjustment,
Yep.
per se, it's a very subtle, sort of more
Very
gentle,
subtle, very
underlying.
gentle, very calm, and very few reasons why you couldn't get it either. There's no big force to it, so just about anybody can receive treatment.
Right. How long does a treatment typically last? If you were doing just a craniosacral, let's say.
Ideally an hour.
Okay.
We can treat in shorter amounts of time, but ideally, in order to fill full scope of a treatment, an hour would be perfect.
Yeah, you don't want to rush things.
Yes, exactly.
Okay. I was going to ask you today, what type of conditions would you normally see and treat as far as a craniosacral treatment goes?
Basically, I shouldn't say basically. Big one is headaches, migraines and tension headaches, post-concussion syndrome, TMJ issues, sore backs, sore joints, fibromyalgia, chronic pain syndromes. We also treat children. So I've had people referred to me for like lactation consultants have referred to help the baby achieve a better latch while feeding.
Yes.
Birth trauma, babies are squished and coming out, so we want to help their systems get back to as optimal as possible. And again, it's very gentle, so it can be done on any age.
Right. How long was your training when you did this? Is this something that takes like years? I guess it takes years to get experience.
It takes years to get experience.
The actual course itself is sort of...
Yeah, the first course, each course is set in 4-day modules.
Okay.
And then you can continue on when you're ready to move on to the next course. So I've taken, they run them in a core set of courses. So there's 6 core courses. I've done 3 of them, and I've also done the pediatrics course. And so they're done 4-day modules, and you can take them as close together or as far apart as you wish, as you want to continue on with your education.
So you've told us a little bit about what somebody might experience when they're on the table. When somebody gets up from your treatment table and is going back into their life, what sort of things could they expect to feel either different or something new?
A lot of my clients say that they just generally feel more space, like their body's back to where it started before everything, started compressing and folding in and the fascia started restricting. Typically they'll feel more relaxed, they'll feel like they can move better. When within 48 hours they may continue to feel things change, so all of a sudden the shoulder starts to feel even better if we were treating a shoulder, or their knee might start feeling better even if we were treating a shoulder.
Right.
But typically within 48 hours they'll feel a big change, a lot of release, very calm, generally sleep better, and that kind of thing.
Right, so somewhere that completely wasn't even part of the treatment plan.
Yep.
Sometimes can do that. Well, that's
Definitely.
awesome. Thanks, Lori. Okay, coming up after the break, we're going to be at the table, and Lori's going to take us through some of the things that she might do in a treatment. So stay tuned. You don't want to miss it. You're watching Massage Matters on Community Connection, only on Rogers TV.